Hey guys, it's Dr. Max. I just had a sports injury and damage to my lateral meniscus. I had my surgery just 3 days ago back in California. I'm now in Florida, back in my clinic. So something I wanted to talk to you about, what hyperbaric oxygen therapy can do for you during post-operative recovery. After any surgery, especially orthopedic surgery. In orthopedic surgery, we talk about meniscus repair, ACL injuries, and other ligamentous injury that ligaments do not have blood vessels that supply oxygen and nutrients directly. So it's all happens by the diffusion. That's why healing takes longer, recovery takes longer. So HBOT, hyperbaric oxygen therapy, can bypass this requirement and provide 700% more oxygen directly if you just go into the chamber at 2.5 atmosphere, for example, right? Today I'll be at 2.7 atmosphere, and at this pressure we can bypass the vascular system with oxygen supply, because oxygen starts to dissolve in any liquid, and in this case in our blood the oxygen starts to dissolve, and this is how we get so much more of oxygen being delivered where we need it. What are the actions of oxygen during hyperbaric treatment? It does reduce inflammation, because there's a lot of pathways that HBOT can reduce inflammation without zero side effects. It can help prevent infection. The most important action is actually angiogenesis. Oxygen is proven, and there are multiple studies in PubMed supporting this claim, to help to create new vascular network, new blood vessels, or neovascularization, what we call it in medicine. It does help to control pain. It does help to control recovery, regeneration of new tissues, new cartilage, and healing. So in my case, I had my lateral meniscus completely torn from the front all the way to the back end, and surgeon Dr. Suleiman actually repaired it with stitches, and now it just needs time to heal. And I will try to do 2 hyperbaric sessions per day during the first week, and then hyperbaric session daily after the first week post-operatively.